Hello everybody, shall we begin? Can you hear me at the back? Because I don't have the loudest of voices. Does my voice carry up there? You can hear me? Great. So it's a pleasure to be here today. I know some of you from my seminar groups for this module, and others I'm meeting for the first time. So I'll introduce myself. I'm Maria Kordovic. I'm Senior Lecturer in Business Psychology here. I have around a 15-year career that was based in forensic settings, in prisons, and predominantly the National Health Service, where I worked as a senior manager. But also, throughout the last 15 years or so, I've run my own management consultancy company, which helps National Health Service settings to develop their organisations. I help to grow and develop teams and team working. And stories are one of the tools that I too have used in my work in order to encourage employee engagement and also, one hopes, improve patient care as well. I'm also a chartered psychologist as well, so I tend to approach my teaching from a psychological discipline too. So I draw on psychological narratives, discourses, and evidence from the literature to support the key arguments that I present. So that's me. I hope you'll find the session interesting. We'll be watching quite a few videos which demonstrate case examples of the application of storytelling in the NHS for various reasons. And I hope you also contribute a bit in this session as well. I am being recorded, as you can see, but whatever you say in the session won't be heard. So please feel free to speak freely, and you're not recorded on camera either. Okay, thank you. So, the session overview. We'll do a very quick recap of what we know so far from the module, particularly this semester, because last semester you did corporate social responsibility and this semester it's storytelling. I'll introduce the National Health Service context. We're talking about employee engagement today, so I'd like us to define what employee engagement is and have a think about why it might be important for the NHS and also other organisations. We'll look at examples of storytelling in the NHS, and we'll see if there's any evidence to say that storytelling in the NHS actually has impact. And this is aligned to Learning Outcome 1, which is about identifying contemporary management problems and thinking about how our practice and how the theory helps us to potentially tackle those management problems. So what do we know so far from this semester? Well, I hope you've all learned and are coming to see how stories can be used as organisational devices. So what I mean by that is stories are tools that help achieve a particular aim. And stories can be used in such a way as to share organisational histories, for instance, to help with branding, help with marketing, to engage employees, to align employees to a particular vision. So aside from learning about the impact of stories and storytelling, we've learnt that stories can have a moral message within them, and they may be a useful way of conveying that particular moral message within the organisation. And I'm sure this has been reiterated week on week, but apart from the role of the story, it's really important to be aware and to analyse the role of the storyteller and also the audience as well. So the storyteller and audience, you should well be aware by now, there is an interplay between all three of them. They are inextricably linked in order to ensure the success or otherwise of organisational storytelling. And you've also started to think about reflexivity, so this notion of identifying the role of the self within a particular scenario. So this ability to demonstrate self-insight, to be reflective, and adapt our behaviours accordingly in order to fit the context in the most beneficial way. Is this all making sense? Nothing foreign there? Okay, good. So, the NHS. I'm sure the majority, if not all of you, have used NHS services in some shape or form. We have NHS services here on campus as well. It is the publicly funded healthcare system in the UK. What it means to be publicly funded is it's funded through taxation, rather than how private healthcare systems are funded, which typically are funded through insurance and also direct payment for the service. It was established in a post-World War II climate. So you can imagine how things look post-World War II. The economy was in disarray. There were huge social and infrastructural problems, and yet off the back of that, this country underwent some very significant social reforms. And along with the creation of Beveridge's welfare state, so you know about the welfare state, which is linked to things like being able to get benefits, the NHS was founded. Don't know if anybody knows who that guy is. So this is Nye Bevan, Secretary of State for Health at the time under Clement Attlee's Labour government. And NHS is very much linked to being his brainchild. And this is him, I believe, and forgive me if I'm being inaccurate, but on the first day of the launch of the NHS in 1948. The founding principles of the NHS still remain today, which is that it offers comprehensive care, so holistic, meeting a range of physical healthcare needs and also mental health care needs. It's universal in that there's universal coverage nationally, so anybody can access the NHS, and it is free at the point of access, so you don't pay for your service when you access it. Money doesn't trade hands. It's indirectly that you pay through your taxation. So that's a bit of a background to the National Health Service. What about employee engagement? What's that? And then we'll link the two together. So employee engagement. When we think about employee engagement, we ask a range of different questions. And in essence, what we're thinking about is what is the nature of the relationship between the employee and their employer? So is it a good relationship? Does it need improvement? Is it perhaps quite toxic and detrimental to both the health of the employer and the employee? When we think about engaged employees, really what we're capturing is the extent to which those employees are committed to the organisation's goals. So is there a commitment? Is there an alignment with the organisational vision? What are the right conditions so that people give their best each day? And you know, with your critical thinking hats on, I would call that into question somewhat, because actually, is it possible to give our best every single day? You know, sometimes we might not be well, maybe we're feeling a bit down, and actually it's a success in itself just to get through the day. So this relentless push for total commitment, total engagement, always giving your best, in itself can have slightly or maybe more seriously detrimental consequences. So I think it's a balance. It's making sure that staff well-being doesn't suffer, and true engagement, long-term engagement, tends to be, in various studies, positively associated with staff well-being. So what that means, if engagement increases, so does staff well-being. And we also have some evidence to say that employee engagement, so when you do engagement questionnaires, you'll find out that it leads to reduced staff turnover and lower sickness absence too. And in order to study employee engagement, we can use both qualitative and quantitative methods, mixed methods too. One example of the way employee engagement is captured within the National Health Service is using the annual NHS employee survey. The 2019 results did come in, so forgive me that I'm using 2018, but I think this captures a particular zeitgeist of the time. So if you just have a quick look at that. So 51% of respondents were thinking about leaving their current role. 21% wanted to quit the National Health Service altogether. .8% of staff report feeling unwell as a result of work-related stress. And at 2018, that was the highest in the past 5 years of the survey. Bit of a bleak picture. And some of these issues now have really come to the fore. So I think all of us are acutely aware that our NHS is coming under great strain, and it has been under great strain really since it was founded. It was founded on the erroneous belief actually that if you offer free-for-all healthcare, the need for that healthcare will reduce because people will get better. But actually the NHS has been a victim of its own success, whereby people are staying alive longer. Improved diagnoses means we discover more diseases that need to be treated. We're also forever developing new technologies and interventions. So one of the problems, and what is described as a wicked problem, I don't know if you've heard that phrase before, but a wicked problem is one that is intractable. So it's one that can never truly be solved. We continue to find or to look for solutions to that problem, but it's a pervasive issue that will exist, and that is that potentially the need for NHS services and demand will continue to grow. So we know we've got the backdrop of the coronavirus at present. So that in itself has really raised these issues. You know, there was this conversation about, well, should we bring back retired staff, which probably, I'm no medical expert, but you know, might not be wise given the population that the virus affects. But also we've started to think about people who've left the NHS, can we bring them back to deal with this increased demand? And we're learning about why people left in the first place, and much of the narratives around that reflect this sort of state. So in 2018, we had just over 325,000 days lost due to stress alone, so days of work. And again, this demonstrates an increase by almost a third in the last 5 years. And I've just selected some headlines here. They are all from The Guardian. We'd expect The Guardian, being more a left-of-centre paper, to hook on to social issues. So there is a particular bias here of reporting, perhaps one could argue. But nonetheless, there is this layering on of bullying, harassment, abuse. You know, paints a really unhappy picture of the NHS as a workplace. You know, there are also many stories that counteract this. And one of the ways of counteracting this wave of malady, of disengagement, is to use stories. And they've been a really powerful device in actually capturing narratives of optimism, of when things go right. So we've looked at a brief definition of what employee engagement is. But how can we really get under the skin of what NHS workers feel keeps them engaged with their jobs? You know, given that quite unpleasant backdrop of employee dissatisfaction. What is it that keeps people going and potentially even loving their jobs? Well, this study by Barker, and this is a word cloud. You know, word clouds, the bigger the words, the more prominent a particular facet of a question. So staff here were asked, what is it that keeps them engaged? And you can see patient, being able to support patients and gaining support. Friendships, your colleagues. Staff development, values, a sense of connection, making a difference. So these are quite wonderful facets, I think, that if we can have these in any job, not least in the NHS, there is an element here of human connection, isn't there? I've put a link into the patient voices. That link has also been put up on Blackboard. And whilst we don't have time to go through it today, it's relatively quick to read, but if you look at it in your own time, so it's www.patientvoices.org.uk, that's an initiative capturing patient stories. So looking at things from the perspective of the patient. And why I put it in this slide is when you read those stories, it's interesting to see how much they echo what staff also find valuable about working in the NHS. So this notion of human connection and values and being very person-centred. Okay. Any questions so far? So I'm going to show you some videos. They're around 3.5 minutes long. Whilst you're watching the videos, I want you to think about what thoughts does it bring up for you? Okay? What do you think of these? Everything is valid. And then I'll ask you after we've watched the video just to tell me from where you're sitting what you think the key messages are here. And how does that feel for you personally? So this was taken from when the NHS celebrated its 70th birthday. And it captured, it's going to be one of those scenarios, I think, where it doesn't play off the screen. Forgive me, I'm just going to Google that for you then.
Invest as little as...
That's it.
They could not believe that they didn't have to pay any money. Because the North East, there was a lot of unemployment straight after the war, and we were still in rationing then. And they could not believe that if they had something wrong, they could actually go to the hospital or the doctor and they wouldn't have to pay any money. You know, a home delivery, if it was the 4th of July, was 1 and 6pence. But if it was born on the 5th, it wasn't anything. And that 1 and 6pence after the war bought a loaf of bread to feed the rest of the family and a tub of margarine. That's the reality of what we take for granted now. When I went to outpatients, I noticed how desperately poor the people were after the war. They were really, really poor, and they could not afford the health insurance they had. I know it was only a penny a week, but even that was hard. So therefore we were handed these little infants, or these infants who were well advanced in their bronchitis or their pneumonia. The difference being that the parents were more relaxed. They didn't have to pay So they brought their children and their families when they were just starting their problem.
I think after NHS came in, we did well, things were happening all the time. I mean, when I first went in, there wasn't a drug to, lower blood pressure at all. So it really was nursing. The best you could do in your nursing. And I think that was a great difference once the NHS came in.
England sent this quota to Grenada asking for nurses to come in to help them out in the workforce in the NHS, in the nursing. So I took the advantage of that. I applied. I was interviewed in my country in Grenada. I passed my interview. Papers came up to England, and England accepted me and wrote back to me and told me they will have me in October when my training starts. Hence, my presence in England from 1966. And I never regretted it. I love the profession. I really enjoyed it. And I didn't want to retire.
It's still a wonderful profession for people to come into and get such satisfaction from being there, from doing what they do to me. And what I've seen them doing during my career, I mean the improvements that have gone along this, the possibility of being part of those improvements is such a challenge, a wonderful aspiration for people. To my mind, a wonderful organisation. The best job in the world.
So any thoughts? How did that make you feel?
It's very nostalgic.
Nostalgic, yeah. There's a sense of connection with heritage almost, isn't there? Yeah, I like that word. Thank you. Anybody else? On this side. Say that again. Proud, proud. And what kind of pride?
It's sort of unique to us that we have this, so I'm proud of it.
Yeah, it is almost a national pride. You know, I was born in Poland and I feel a sense of national pride for the NHS. You might have spotted my I Love NHS badge on my first slide because I really do. You know, I feel such a connection to its kind of very fibre. Yeah, absolutely. And lastly, on this side. What did you think when watching that video? Grateful? Where's that coming from? Thank you. That it exists. And what else about that? Where does that gratitude stem from? Yeah, that it stemmed from the worst time and it still exists today. It's quite an achievement, isn't it? I mean, whatever we think about whether it should be public or private, you know, the NHS does end up being a bit of a kind of political, at the mercy of political whims, I guess. Nonetheless, I don't think any of us can doubt what a huge and amazing undertaking this was, particularly given the climate. Thank you. So next one. I mean, we could watch this in the interim. There it is. So this captures accounts, but through digital media. So have a think about here how social media tools can be used to capture stories.
Hello, my name is Dan Smith and I'm a consultant paramedic for the North West Ambulance Service. Using the new @NHS Twitter account means that staff like me and patients like all of us can tell our NHS stories.
So you join me live on the ambulance deck at the Northumbria Hospital. I'm currently halfway through my shift. It's been a relentless onslaught. We've had a lot of positive things happen today. Obviously, I can't say too much, but life on the front line, I wouldn't swap it for the world.
The most rewarding bit of my job is my colleagues, the team that I work with, and the patients that we meet. Every day is completely different, and every patient has their own little individual story to tell.
Lovely. So what did we think of that one? Any thoughts on that? Why do you think they made this video? Any ideas? Does it capture your interest? Some nods. Does it make you feel like you might want to follow this Twitter feed if you're on Twitter? Perhaps? I mean, that was the purpose, wasn't it, to promote it? But there was that powerful message. So the gentleman there who works for the NHS but is also treated by the NHS for cancer, it's quite a powerful story, isn't it? And we can engage with that story. That story is just delivered through, I think back then it was 100 characters. So there can be a real brevity. But despite that, a very powerful story is captured, isn't it? It's this notion that actually, there isn't an us and them divide. The staff are also human beings who also get ill, who also will at some point in their lives need NHS treatment. So it breaks down that hierarchy, doesn't it? Sharing those kinds of stories. There's a humanity there, would you say? Yeah? And did you spot the bit where their Twitter accounts are actually curated by different people? I think that every day, potentially, so different staff at all layers. And they get given quite free rein as to what to tweet, and it gives you a real insight into the stories of their work and a bit of an insight into who they are as people. It's a really interesting use of social media to share stories in real kind of bite-sized, tiny chunks. And it can lead to brief human connections, even digitally. Okay. Just one more video to show you. But before that, actually, let me show you this example of a project. So you've seen videos as a way of conveying stories. I'm showing you videos here, of course. Ideally, we would have had a member of NHS staff come and tell us their story, or a patient. But because that wasn't possible, I've shown you videos to give you an insight. But there's kind of more to this. So the key is, stories can be told face to face. They can be conveyed through written form, through digital media, through video. But this particular project, Telling Stories.nhs.uk, if I just show you the website, it's a way of using stories to get people thinking about genetics and their own experiences when things go wrong or right in terms of their treatment around their genetic diseases. And what this website asks people to do is to submit their own stories, so it's a kind of free-for-all. It talks about why use stories, and to the founders of this website, stories are a really powerful tool that help educate staff and also other patients about an experience of particular diseases. And through this better understanding, we are able to better tackle complex situations. Because our health, our well-being, it's quite a complex entity. There's lots to it. There are biological factors, psychological factors, social factors. We talk about that as the biopsychosocial picture of health. So we're quite complex human beings. And what this particular initiative claims is that stories can help us make sense of that complexity in our realities. And as a result of the stories, they've also created various toolkits, things that patients and health professionals can use, and how to actually use those stories and how to select them. So this is a real kind of in-practice use of stories that can be used with patients, and in this area, in the area of genetics. And just the last video. Because we've not actually heard kind of directly from a patient yet, but of course patient stories lie at the core of the NHS, don't they? So what the patient experience is. And this is a lady talking about living with Parkinson's disease.
My name is Karen Rose and I've had Parkinson's disease now for 10 years. I was 34 when I first noticed symptoms of Parkinson's disease. At the time, my dad noticed that I wasn't walking properly and that I wasn't swinging my right arm. And at work I found I was miskeying when I was doing keypad work. A year or so later, I had a car accident and I started a tremor. Over the following year, I realised this wasn't right. Every time I was anxious or upset, I started a tremor. I went along to my GP and he didn't know what was wrong, but he could see something wasn't right and he sent me to a neurologist who decided to give me a tablet to try. It worked, my symptoms improved, so confirming Parkinsonian syndrome. I went back to see the consultant and he gave me the medication that I had to take every day and would be taking for the rest of my life. Parkinson's disease, people consider it to be an old person's disease. Every time I mention the fact that I have Parkinson's, people always say, you're not old enough, you look fine. And when my medication's working, I do look fine, but they don't see the times when the medication's worn off and I'm struggling to move and do everything that everybody takes for granted. Generally, the symptoms I have during the day, I wake very stiff and slow. I need medication to help me get going in the morning. I then take medication all throughout the day to stop the symptoms. I go from being very slow and stiff and hardly able to move one foot in front of the other. Although stairs aren't a problem, I can run up those quite easily. It's walking I have difficulty with. As these tablets wear off, I do generally become worse. The twitching that I suffer from is more a side effect of the medication as opposed to the disease itself. I need to take medication regularly. If I don't take it regularly, then I start to slow up and I become very stiff and I'm unable to do what I want to do. So it's very important to take your medication on time. I have a pill timer which reminds me when I'm due to take a tablet, although sometimes even then I forget and then I know it. The family are very supportive. My husband has got to do a lot more around the house now than he ever did before, and the children too, but they do it quite willingly. At work, I was very lucky. I had a very supportive boss who just made sure that I could do the jobs that suited me at the time. If I was having a bad day, they just let me do a job that I could manage. They never put any pressure on me. When I was first diagnosed with Parkinson's disease, I didn't know anybody that had Parkinson's, only very old people, and this wasn't what I was looking for. I tried to find out information, but I couldn't find any information anywhere. I was lucky that Parkinson's disease specialist at our local hospital put me in touch with the Bristol branch of the Parkinson's Disease Society. They were able to give me support and help, and as a result I joined their committee so that I too can help other people diagnosed with young onset Parkinson's disease. It's very important to talk when you find out you have Parkinson's disease. Go along and find a support group. Ask your GP if they know where one is, or contact the Parkinson's Disease Society. Look on their website, they have contact numbers of people that you can contact and talk to. The important thing is that I don't think you ever accept that you have Parkinson's disease, but you need to learn to live with it. Don't let it live your life for you. Do what you can, when you can, and stay positive, because this will always help.
Okay, so real insight into that lady's day-to-day life and also how health services have helped her connect. And this notion of other people who are experiencing the disease getting together to share their experiences, even that, there's an element of storytelling there, isn't there? So I think, and I know that was a very kind of whistle-stop tour through some stories from the NHS. But to summarise what we've seen today, purpose of storytelling in the NHS, there are many purposes. So, everyone has a story, staff, patients, there's an element of capturing organisational histories to help people engage with the values, with meaning, with that pride. Employee engagement, so again, for employees to be proud of the work that they do, for their stories to be celebrated, for the value of their work to be demonstrated and captured. To engage the public, so these are public-facing campaigns. So it's to get the public to actually develop an empathy, not only for patients, but also for NHS staff, that they're not some kind of superhuman race, quite the opposite, they're just like us. So they need respect and recognition for the hard work that they do. Stories help to educate. So that Parkinson's story offers a lovely, brief, but lovely insight into that lady's life and some of the challenges she might be facing, and helps educate not only other people experiencing Parkinson's, but also healthcare professionals about some of the needs that patients with a diagnosis of Parkinson's may be experiencing. It may help people manage their health condition, particularly if they share stories with one another and learn from one another too. And there's this notion also of tackling complexity. So stories capture attempts and ways of navigating wicked problems. And in the case of the NHS, there's the notion of human health and how we manage it, how we meet demand, how we meet needs that can be described as a wicked problem. And stories help us see a way through that, through greater understanding and shared empathy. And a lot of what I've said is quite anecdotal. What I mean by that is it's not necessarily factual or supported by research evidence. So in this slide, just want you to look at some of the evidence around the impact of storytelling in the NHS from the academic literature. So one study, which was actually a review of the literature base, looked at digital stories and argued that if we co-create, so if we design digital stories together, a bit like that Twitter digital story, so health professionals and patients get together, it can really enhance learning. So it could potentially be used in the training of healthcare professionals. Another study found that storytelling can be a useful intervention when it comes to chronic disease management. So when patients share their own stories, one can identify as a healthcare professional the gaps in knowledge and skills for both the professional and the patient in managing their condition. But also if patients share stories together, and we know there are groups, I don't know if you've heard of experts by experience, but if people have chronic diseases, most or several NHS trusts offer these groups where patients can get together and speak to others. And these shared storytelling experiences can help form strong bonds. There's an argument as well that employee engagement can be achieved through stories, but we must also formulate a clear strategic narrative. So a story around our strategy as to how we will engage employees in the NHS. So that's almost like a meta view, whereby you've got the stories for employee engagement, but what's our top level story about how we are going to engage employees? And it's important to get that clear in order to be effective. Real life stories by patients inspire staff. They increase empathy, compassion, and kindness. So that's important, again, that humanity. And storytelling is an accessible yet powerful tool which contextualizes and humanizes nursing knowledge, facilitating a deeper understanding of self and others. So this particular quote from Bowles highlights almost this reflexivity element, wouldn't you say? So stories hold up a mirror to self and get us to reflect on our practice. So what have we learnt today? I hope you've taken away a bit of a sense of what employee engagement is. The NHS context, the use of stories in the NHS, the impact, but not only on employee engagement actually, but more broadly. I've given you a link to an article. It's not an academic article, but if you're interested in reading more, very quick read. But the author here argues how stories were used when the NHS was celebrating its 70th birthday to help the public fall in love with the NHS again. So what a powerful public engagement tools stories were. Are there any questions or points? Before I let you go, can just one person, whoever that might be, say what your take-home message is from the lecture today? Anybody want to share their take-home? What are you taking away from this lecture? Just one person. Have a go. Do you want to have a go that row? I can see you kind of talking amongst each other. What are you taking away?
Just our employee engagement in NHS.
Yeah. And would you say storytelling is a useful tool for that? How so?
It lets the company, employees know what patients are going through in outcomes.
Yeah. So lets employees know what patients are going through, and that helps to drive engagement. Thank you. Appreciate you putting that forward. So next week, Kudrat is going to look at the theory underpinning this. Okay, and meanwhile, it's lovely to meet those of you that I didn't know, and thank you for paying attention. And see you again. Thanks, guys.